Good day, future doctors and medical technologists. Welcome back again to another episode of HIS Lecture with me, Sir Neil, and I'll be your professor for today. So today we're going to talk about the health system. Okay, so this topic is very important to us, especially we are Filipinos living in the Philippines, no? Medyo hindi naman ganun kaganda ang ating health system, but we are slowly getting there. Okay, so at the end of this lecture, I want everyone to acquire, no, or obtain the following learning objectives natin. So define what is a health system in the international, national, and local perspectives. Identify the goals and functions of a health system. Explain the relationship between the system building blocks and health outcomes. And lastly, familiarize with the structure of the Philippine health system. So obviously, since you are in the Philippines, you need to be familiar, or you need to know the structure of our current health system here in the Philippines. So after this slide, I'm going to show you a video showing the best healthcare system in the world. Okay, so let's move on to the next slide.
Medical science has made rapid changes over the last century. As technology has evolved, our ability to understand and treat illnesses and ailments has improved at astonishing rates. But that is just medical science. The healthcare systems across the world don't necessarily improve at the same rates. In fact, healthcare systems across the world differ greatly. Let's look at some examples of how different countries handle healthcare. Luxembourg is not only a wealthy and beautiful country with natural sceneries, it also has what is said to be the world's best healthcare system. Their public health fund is made up of 5.4% of each citizen's gross income. This fund enables the country to provide its citizens with free, high-quality healthcare. Luxembourg also has the lowest mortality rate among the EU member countries. Singapore has a hybrid healthcare system, sharing medical costs between patients and the state. A number of plans are in place to ensure all citizens can afford healthcare without relying heavily on the government. These plans are dependent on a variety of indicators such as salary, income, and health status. Less money spent by the state on patients enables hospitals to be renovated and more doctors and nurses to be recruited. As a result, Singapore has a very high average life expectancy at about 83.1 years, as well as low rates of infant mortality at just 2 per 1,000 births. Being one of the world's wealthiest countries in the world helps when it comes to providing an efficient healthcare system. With more money to spend on equipment, research, and medical staff, citizens of Switzerland receive healthcare that is up-to-date and efficient. Its healthcare service is universal and is based upon the mandatory holding of health insurance by all citizens. Japan's public-private hybrid healthcare system saves the government a lot of money and enables the country to provide a high-quality service. In fact, it is one of the cheapest healthcare systems in the world. Austria has a healthcare system based on mandatory health insurance. Austrians pay a premium of around 25 euros per month for their health services. Sweden is characterized by high standards of quality care and above-average healthcare spending. The country has a high proportion of doctors and well-connected network consisting of public hospitals and private clinics. Even though upfront payments are the norm, the fees are reasonable and prescriptions are subsidized. Health insurance is compulsory for all citizens in the Netherlands, and for those who cannot afford insurance, the Dutch government provides financial support. Over 4,000 euros per citizen and more than 10% of the GDP is spent by the government on healthcare. This is among the highest amount within the entire European Union. Spain offers free, universal healthcare to anyone who is a resident legally or illegally in the country, as well as to tourists and other visitors. Some 90% of Spaniards use the system, with about 18% signing up to private healthcare schemes, including many public sector workers who are given the option of free private care. The Danish have a universal healthcare system that provides them with mostly free medical care. All permanent residents are entitled to a national healthcare insurance card, and most examinations and treatments are free of charge. Canada has a universal, publicly funded healthcare system that consists of a group of socialized health insurance plans providing coverage to all Canadian citizens and permanent residents. Every citizen is provided with preventative care, medical treatment, access to hospitals, and dental surgery. Canada holds a remarkably high life expectancy rate, which many attribute to the efficiency of its healthcare system. Of course, these are just a few of the many systems across the world. Medical science is moving forward at incredible speeds, making treatments more easily performed and even granting the possibility of treatment to patients who previously thought there was no hope. But the accessibility of these newly possible treatments can be bottlenecked by inefficient systems.
Okay, since napanood ninyo ang video guys, no, you can clearly see the different types of health system in the different countries or different parts of the world. And even though that the medical science is evolving fast, no, if the health system is inefficient, walang mangyayari. Okay? So, kasi guys, ang health system is not just the medical services, not just the medical science, no, but system ang siya. So, when you say system, there are different types of components. Okay? Just like itong sinasabi ngayon ni Romer in 1991, okay, sa book niya titled National Health Systems of the World, the Countries. Okay, si Milton Erwin Romer na siya, okay, in Oxford University. Sabi niya, healthcare system is the combination of resources, organization, financing, and management that culminate in the delivery of health services to the population. Okay? So, ibig sabihin, marami talagang components ang ating health system. So, let's try to dissect ano yung mga components ng health system. Okay? So, let's start. So, these are the different components of a health system. We have the community, department or ministries of health, healthcare providers, health service organization, pharmaceutical companies, health financing bodies, other organizations related to the health sector. So, each plays a role in the system such as the governance, health service provisions and financings, and managing resources. Okay, so another example of health service organization would be your WHO. These are the different health service organization, no? WHO and the CDC or the Center for Disease and Control. Okay, so let's try to check, no? Let's start with the WHO report in 2000. Okay. So, WHO report in 2000, no, sabi niya, health system is all the organizations, institutions, resources, and people whose primary purpose is to improve health. So, does it state the same meaning with Romer? Yes, no, it states the same meaning with Romer. Okay? So, ibig sabihin nito, no, a well-performing system provides direct health improving activities in personal health care, public health services, or intersectoral initiatives to achieve high health equity. Being mortal as we are, we do get sick. So, a country must have a system in place that takes care of our health needs for the population to survive. Okay? So, dapat ano talaga siya guys, no? Primary purpose is to improve health. Okay? So, we have different goals of health system. So, these are the primary goals of a health system. So, number 1, improving the health of the populations. Number 2, improving the responsiveness of the health system. Number 3, providing fair health financing. So, these are the 3 main goals of health system identified by the WHO or the World Health Organization. Okay, so I'm going to explain it one by one to you. Okay, so let's start with number 1, the improving the health of the population. So, improving the health of the population is the overarching goal, no? Overarching goal of the health system. Health status should thus be protected from existing and emerging health risks. Intensive preparations for resilience to impending but still unknown health risks must be executed to ensure the safety of the population. Health systems should strive for equity in health by minimizing inequitable disparities which may caused by certain factors such as your income, ethnicity, occupation, gender, geographic location, and sexual orientation, and among others. There are significant variation in health outcomes across the world, within regions and within countries. So lahi-lahi jud ang health outcomes nato across the world, no? Countries and regions with relatively similar socioeconomic status may have quite disparate health outcomes. The health systems are organized. This contributes to this disparity. These disparities are most effectively reduced when they are recognized and their minimization becomes an explicit national goal. So, ibig sabihin po, no, since the number 1 goal, no, one of the main goals po ng ating health system is improving the health population. So you're not just looking at it individually, but rather as a population po. Okay? So ibig sabihin po dito banda is that sabi dito, populations must be protected from existing and emerging health threats. So, ibig sabihin, hindi naman pasabi na each country, no, is press lang ang sakit, no, magkakaiba po yung sakit per country, no, at same time, no, merong country na ito yung ano sa kanila, ito yung pandemic sa kanila, ito yung madalang na sakit na meron sila, meron namang country na iba, okay. So, the health system should be there, no, para ma-prevent yun siya or ma-minimize po yung ating risk exposure to those types of diseases. Okay? For the goal number 2, we have improving the responsiveness of the health system. So, when you say responsiveness, it refers to providing satisfactory health services and engaging people as active partners. It embodies the values of respectfulness, dignity, confidentiality, autonomy, quality and timeliness in the delivery of health services. So remember po, health system also have an obligation to respond to the legitimate non-health needs and expectations of the population. Responsive health system maximize people's autonomy and control, allowing them to make choices and placing them at the center of health system. So ibig sabihin, there is a free will, no? The free will, the quality of reacting quickly and positively. Okay? So, let's move on to the next goal. We have the goal number 3, providing fair health financing. Okay? So, an ideal health system provides social and financial risk protection in health. Okay? So, according to the World Health Organization, each individual pays approximately the same percent of their income for needed services regardless of the social status in life. So, obviously po guys, no, this is more noticeable sa mga nagatrabaho na po. Okay? So since for example kami, no, we do have our PhilHealth na responsibilities. Okay? So per month po we are being tax, 'di ba? Tax by the government para magbigay kami ng amount ng salary namin for the PhilHealth whether we use it or not, no? Kasi nga ano kasi siya guys, there are different models on how does the PhilHealth work. So it will be discussed later on. But anyways, yung ating yung salary namin will be deducted po. Yun siya, monthly na siya guys, no, mabawasan ng small percentage lang naman. And then whether we use it, whether magamit namin or hindi, no, ano talaga siya guys, no, mandatory talaga siya na binabawasan. Okay? So, pag nabawasan siya guys, if in time na kami naman yung mangailangan, yes po, doon namin siya kukunin. Okay? So, ito yung po yung sinasabi dito, providing fair health financing. Okay? So, it is yung mabawas sa amin will be given to those who are needing it at the moment. Okay? So, let's start talking about the function of health system. So, these are the different functions of health system. Health service provision, health service inputs, stewardship, health financing. Okay, so isa-isahin natin yan sila. For the health service provision, this is the most visible product of a health system, public and private health service provisions. Health service is any service not limited to clinical services aimed at improving the health population. The most visible product of health system is the public and private health service provision. There is a very, very concrete evidence of this. Health service is any service not limited to clinical services po, no, aimed at improving the health of population, no. Pwede po na siya na kanang dili lang kanang laboratory test, mga no, lahat po ng services. For example, when you conduct lecture para sa against dengue, yung mga those are already service po, no, na health services. Okay? Preventive measures as well as promotion of a healthy way of living to avoid illnesses is also part of the best system. Thus, the system has to perform a wide range of activities to cater these various demands. The best healthcare systems have preventive measures and promote healthy ways of living. So, ibig sabihin, it is not limited to only yung mga free laboratory tests. Hindi lang po, no? When you educate people on how to live healthily, that is already an health service po. Okay? So, let's take a look, no, sa function number 2, the health service inputs. Health service inputs or managing resources means generating the essential physical resources for the delivery of health services, which includes medications, human resources, and medical equipments, no, such medical equipments. Resources such as trained doctors and medical staff and supply of medications often take time to be produced. Hence, the health system policymakers have to respond and use available resources to address short-term population needs. Obviously, becoming a doctor takes around 5 years to complete. Okay? So, ano siya guys, kanang for the meantime na we are waiting for future doctors po, no? So the system should have a plan to use the available resources na available sa atin. Okay, that's why meron pong meron pong ang ating DOH program po, yung libre po ang pagpaaral ng medicine, pero meron po siyang return service per year po na natapos natin. Okay? Yan. So let's move on to the function number 3, which is the stewardship. Okay? So stewardship, when we say stewardship, that is the job of supervising or taking care of something such as organization or property. Okay? So it is also known as overall system oversight. No? This is the main responsibility of the government. When we say stewardship, guys, basically yang ikaw ang ikaw ang nagmamaneho. For example, you are the steward of your own life. So ibig sabihin, ikaw ang responsible, no, na mag-make ng path nimo kung ano yung mga decisions, ingana. So ikaw ang responsible. That is the steward. In terms of healthcare system po, or the health system, okay, this is the main responsibility of the government, since they are trying to improve the health of the general population and the country where they are situated. Ibig sabihin, sino pa ba ang may main responsibility nito? The government natin. So, the core summarizes the identifying health priorities for allocation of public resources and coordinating activities with others, generating appropriate data for effective decision making and policy making through the use of research. For example po nito guys is the Mycobacterium tuberculosis, yung TB dots. I hope you are familiar with the TB dots. Okay, the TB dots program po was developed by the government natin, no. 6 months na gamutan po yan siya, no, because they observe, no, because of research, they have garnered data na okay, marami palang Pilipino ang naapektuhan ng TB, so we're going to make this program. Nagets niyo? Since because of the research na establish nila, they know na rampant ng TB ngayon, so they develop a program to kill or to minimize po or to help those people na naapektuhan po ng TB. Okay? So 6 months din siya nagamutan guys, medyo matagal yan siya. Okay? Remember, there are a lot of diseases and they are all important, but there are just some that needs the utmost attention. So obviously, maraming sakit, pero yun, for example, the TB is a much more priority ng government natin na bigyan ng program because nakakapatay din talaga siya. Okay? So let's move sa function number 4, the health financing. So this includes raising and pooling funds, resources to pay for the health services such as revenue collection, risk pooling, strategic purchasing. Okay, so I'm going to discuss this 3 one by one. Okay, so remember po, this is where we raise funds po, no? Doctors and staffs need to be paid, so where do we get the money to pay for their services? So for example, sa government hospital po, merong iba dyan na libre po, diba? Libre yung mga testing, libre po yung mga medicine. So how do the doctors and nurses and other medtechs there get paid? So ito po yun sila. Let's start with the revenue collection. Okay, start with the revenue collection. Okay, for the revenue collection, revenue is the money earned from payments for healthcare services. The mechanism is through the use of general taxation, donor financing, mandatory payroll contribution, direct household out-of-the-pocket expenditures, and other forms of personal savings. So each source of health financing is associated with a specific manner of organizing and pooling of funds and purchasing services. Public health system rely generally on general taxation for its funding. Ito yung sinabi ko kanina, no, na ginabawasan kami. While social security organization are funded through mandatory payroll contributions from workers and employers. So these are different naman po yung siyang yung mandatory payroll contribution. So general taxation po is yan po yung tawag yan, mga nabibili, for example, meron kang binili na isang item sa mall. So, makita niyo yan guys, meron dyan mga value added tax. So, lahat yan mapunta po yan sa government po, yung mga value added tax. Ito mandatory payroll contribution, I'm going to correct myself po. Ito po yung sa amin, no, the mandatory payroll contribution. Masakit siya guys, no, pero sige lang, tulong ko na yan sa Pilipinas. Okay? So, ano siya, it is a percentage po ng sahod namin. For example, let's say for example I am earning around 1,000 joke, 100 pesos a month. So 5% niyan is 5 pesos. So 5 pesos po yung kakaltasin sa'yo. So kung mas malaki sa 100 pesos yung sahod mo, yes po, malaki din yung mabawas sa'yo. Okay? So kung 1,000 na siya, no, 50 pesos na. Kung 10,000 na siya, 500 pesos na. Palaki po siya ng palaki. Okay? So let's take a look at the graph, no, kanang sa figures showing the money allocated for medical healthcare per country. So this graph shows the money allocated for medical healthcare per country in dollars every 5 years since the year 2000. Okay, so kita ninyo, no, from 2000, 2005, 2010, palaki ng palaki po yung gina-allocate because the population is increasing. Okay, so let's take a look asa ba diri ang Pilipinas. Ayan, sa figure number 31, that is the Philippines. Okay? For the Philippines, as you can see, no, ang niya for the year anong year na to? For the year 2015, okay? For the 2015, we have 323 US dollars, no? So, let's say multiply natin siya ng 50 pesos. So, that is 16,000 per person allocated as of 2015. Okay? So, per person, yun yung na-allocate niya. Okay? Na nakuha nila ng mga funds po. Okay? So, let's take a look at another health financing, the risk pooling. Okay? The risk pooling po is, when you say pool, by the way, it means gather, no? Gather together or combine. When you say risk, kung in health, it means if you get sick or if you die, no? Yan yung risk natin, no? This is where pool together funds from people's taxes or income to finance or pay for another person's expenses. Okay? Financial risk pooling is a form of risk management which aims to spread the financial risk from one individual to all pool members. So, ibig sabihin, ito na po yung guys, no? Ito na yung nangyayari. Yung sinabi ko kanina, whether we use the money deducted from us, kay wala kaming sakit, no? Mag-deduct talaga sila, no? Mag-deduct talaga sila. Okay? So, it is considered a core function of health insurance company. So if you are familiar with healthcare insurance, for example sa mga parents ninyo, no, monthly meron yan silang binabayaran, no, para in the time na sila magkasakit, need nila ng financial assistance, no, the health insurance company can cater them. Okay? So for the meantime na wala pa silang sakit, na monthly pa din sila magbabayad. Okay? So this mechanism prevents outright payment for health services which discourage patients belonging to the poor sector from seeking healthcare. So admittedly, there are some people talaga na ayaw magpa-check up, ayaw magpa-hospital or ayaw magpa-check sa doctor because they thought that they are poor, no? Kanang syempre pobre rami, dili mi pwede mag-ingana. No. Actually guys, no, the government is really trying their best po to make sure that once na magpunta sa public hospital ang mga people, no, regardless how poor they are, no, they can achieve healthcare service. They will be given healthcare services, no. But dili pa nga naka-perfect guys, no. But slowly we are getting there. Okay? So, participation in effective risk pooling helps families from financial losses due to health shocks, thus ensuring financial protection. Each country has its own approach to managing its financial risk to finance its healthcare system. Multiple and fragmented forms of risk pooling arrangement is in most developing countries. So, ibig sabihin, different countries have different forms of risk pooling po. Okay? So, sabi dito, most high-income countries follow one of the two models. We have the Bismarck and the Beveridge model. So, I'm going to discuss ito sila. Okay? So, I hope na-gets nyo. We say risk pooling, guys, no? Let's say, for example, this is you. You are going to contribute something, no, monetary ba, you're going to contribute monetary, ipopool niyan siya lahat, no, and then whether you use the money or not, let's say wala kang sakit, so hindi mo talaga magamit yun, The other people po na nag-pool din, if ever na sila yung mangailangan, no, dun mapunta sa kanila. Okay? And then if ever naman ikaw, you will be given as well. So merong ibang health insurance po na, let's say for example, kung 30 years ka nagahulog, at the end ng 30 years mo na nagahulog sa kanila, bibigyan ka ng, let's say, around 2 million, 1 million, depende po na siya sa health insurance na. I'm not going to promote health insurance po, no? So, pero yun po yung mechanism ng health insurance. Okay? So, let's talk about the Bismarck model. So, Bismarck model, guys, remember, this model is named after the Prussian Chancellor, the Otto von Bismarck, known for inventing the welfare state in 19th century as part of the unification of Germany. Remember po, Prussia was a historically prominent German state. Okay? So, this is an insurance system where the sickness fund finances both the employers and employees through payroll salary deduction. So, parang ito yung model na ano natin. Pero I'm not going to say na ito talaga yung sa PhilHealth, no? Kasi nga, this is just one of the models, okay? Pero kung nakikita ninyo, diba, does it make sense? Yes. Okay, so most likely, isa to sa mga model na i-follow ng ating PhilHealth. Okay? So, we have this different underlying principle. Okay? The health insurance covers everybody. Okay? This model is widely used in these countries. Okay? So, let's take a look. Kung ito siya, ang Bismarck model is insurance where the sickness funds, no, is kinukuha niya through payroll and salary deduction. Let's going to salary deduction. Let's going to take a look ngayon sa ating sa Beveridge model. Okay, sa Beveridge model tayo. For the Beveridge model, guys, healthcare is provided and funded by the government through tax payments, no, which is shared by the government. Model is named after William Beveridge, the social reformer responsible for designing Britain's social security system and national health service. Underlying principle of this is healthcare is a basic human right. So, kung ito yung kanya, healthcare is the basic human right. Ang kay Bismarck naman, health insurance covers everybody. I hope tandaan niyo ha, si Bismarck, health insurance covers everybody. Ang finances is taken from salary deduction, no, payroll deduction. For this one, healthcare is a basic human right. So, remember po, dito naman, funds are taken or funded through tax payments. Okay? Through tax payments. So, remember po, dito na papasok sa Beveridge yung sa mga doctors natin, no? Doctors may be government or private employees who collect their professional fees from the government, no? This result in a low cost per capita since the government controls the healthcare services. Okay? Countries using the Beveridge plan are ito as follows, yung Hong Kong, Great Britain. So, ngayon, since I discussed the two, the Bismarck as well as the Beveridge, no, actually, PhilHealth is a combination po, is a mix of the two models, no, the National Health Insurance Model. Okay, National Health Insurance Model, that is for the PhilHealth po. It is a combination of both the Bismarck as well as the Beveridge model. Okay, so I hope klaro po yan siya ha. Ang PhilHealth is a combination of both, no, kasi nga for the Bismarck, kami sa workforce, we are being deducted, no, through payroll deduction. And also, kapag mangailangan naman tayo, let's say for example ako, I decided to work in a government hospital, I will be covered po, no. Yung sahod ko will be taken, no, from the tax payment po. Okay? Yung sahod ko is dun kukunin. Okay, so let's talk about the last one, the strategic purchasing. Okay, so strategic purposing, when say purchase, it means to buy. When say strategy, it means the game plan, no, the plan of action, no. Okay, so purpose nito is used to collected funds and pool financial resources wisely to finance healthcare services, minimize costs and maximize the quality. The important part of boosting efficiency and profitability in your company institution. Save more by getting the best deal. So basically, guys, no, in terms of health financing, no, in order for you to get the best quality po, you need to be strategic in your purchasing agenda. Okay? So dito po, no, dito na part is that si government po ang nag-aisip, or kung sino man yung healthcare insurance na But in the Philippines, it is the government. The government now will try to check kung ano yung need, and then ano yung mga best deals na pwedeng para makakuha tayo na. Sometimes we tend to buy equipments from outside the country para mas magandang quality, no? Yun yung ginagawa ng government natin. Okay? So, since we already know yung ating mga different components ng ating health service, okay, the functions, no, the function of a health system, let's try to take a gander sa World Health Organization po na framework. Okay, so let's try to take a look at the framework of the World Health the system, no, the World Health Organization health system framework. So remember po that for a health system to be successful, you should have the following foundation, no? Ito yan siya. Let's try to take a look. Okay? So, ito yan siya, the building blocks in the World Health Organization health system framework. We have service delivery, leadership and governance, financing, health products, vaccines and technologies, health workers, and information. So, let's try to discuss it one by one. Let's talk about the service delivery. It refers to the timely delivery of quality and cost-effective personal and non-personal health services. No, it should be punctual, na done or occurring at a favorable or useful time, no? Ibig sabihin at a very good opportune, no? There should be a quick turnaround time. For a patient who is dying, timely delivery of service is crucial to save that person's life. Okay? For the next one, we have the leadership and governance. The task of ensuring effective stewardship of the entire system. I already discussed what stewardship means. Okay? Ensuring effective stewardship of the entire health system. Excellent leaders and managers that can supervise effectively. Okay? So, this building block also covers the tatlong bagay, no? The monitoring of the accountability of private and public health agencies. Number 2, proper system design. Number 3, appropriate regulation of health system. Ulitin ko ha, leadership and governance also covers itong tatlo. Monitoring the accountability of private and public health agencies, proper system design, and number 3, appropriate regulation of health system. Okay, so let's talk about financing, no? Another building block. Okay, financing, appropriate funds for healthcare services to guarantee that people can use health services when needed without the fear of having not enough resources to pay for them. So obviously, no, here we need to help those who do not have the financial capability. So the government is actually doing this one by using the both models po, no? Like for example, ako ginabawasan na ako monthly whether I need it or not, no, para mabigay or magamit na ibang tao po. Okay? So, masakit ba? Ganun ba? Yes po, masakit siya. Pero it's okay, no? Kasi since I know that monthly I am helping people who are poor and in need. Okay? So, we have the number 4. We have the health products, vaccines, and technologies. This is made accessible through uninterrupted supply, well-managed pharmaceutical services, and education on proper use of medication. Okay, so let's move on sa tayo, no? Sa workforce, sa health workforce. So this includes individuals and groups working towards the achievement of the best health outcome by being responsive, fair, and efficient. So remember po, no, the number of staff in hospital should be sufficient and fairly distributed to ensure competency, responsiveness, and productivity. So tayo po as a medtech, or kayo, no, future doctors natin or medical technologies, remember po that when you do work in a hospital, there should be a teamwork and collaboration, because if there is teamwork and collaboration, you can assure the patient that the health outcomes will be responsive, fair, and efficient. Okay, lastly, the last building blocks in health system framework ng WHO would be the information. Here po, when you say information, no, analyzes, disseminate, no, and use reliable and relevant information. When you say analyze, it means to inspect or scrutinize, no? I-double check, check tama. Disseminate means to spread, circulate, disperse, or distribute. When you say relevant information, relevant means dependable, authentic, no, and timely. Okay? So, on health status, determinants, and system performance. Okay? The right information can help in the proper management of patient. Obviously, 'di ba? So, kung tama yung information natin, we can really therefore manage the patients better. Okay? So, for the next slide po, I am going to show you, no, na kung ano yung framework natin, no, yung ano yung ginagawa ng ng framework. So itong naka-color brown, these are the building blocks, okay? And ito yung mangyayari. Okay? So this framework, the WHO Health System framework natin with the blocks na naka-brown, okay? This framework would ensure that the health system has improved efficiency, social financial protection risk, okay? Risk protection, improved level and equity of health, and good responsiveness. So ibig sabihin there is a safety, quality, coverage, access. Okay? So ibig sabihin again, there is safety from non-desirable outcomes or harm. There is a backup contingency plan. You can still recover in cases of disaster or calamities. Okay? So, for the next slide, we're going to talk about the Philippine health system. Okay, so kanina we are talking about the the WHO, no, na framework. So now we're going to talk about the Philippine health system. Okay? So, let's move to the next slide. Okay, the Philippine health system. So here, in this topic, we're going to know how the healthcare system of the Philippines was formed. Can be summarized with the following important milestones in history. The health reform initiatives carried out over the years in the Philippines were primarily focused on these areas of concern. Number 1, health service delivery. Number 2, health regulation. Number 3, health financing. These health reforms aimed at addressing issues such as poor accessibility, inequity, and inefficiency of the Philippine health system. Okay, so let's start talking first about the Philippine health system background, no, the historical background of the Philippine health system. Okay, so in 1979, there is adaptation of primary healthcare strategy, no, promoted participatory management of the local healthcare system. Okay, so here po, remember that the primary healthcare or the PHC is essential healthcare based on the methods and technology made universally accessible to individuals. So most likely there are some people who went abroad, no, and take a look or take a gander at the health system po ng ibang bansa, and then they thought na oops, dapat meron din ganyan sa Pilipinas. Okay? So remember po, we are aiming for the healthcare to be a basic, no, kanang basic na accessible siya, no, basic siya na necessity, no, rather than a specialized level for people making initial approach to a doctor or nurse for treatment. Okay, so in 1982, let's take a look anong nangyari sa 1982. So 1982, there is a reorganization of DOH, no. So the reorganization of DOH was done to synchronize health structures and operation with the shift to parliamentary form of government. Hence, it became known as the Ministry of Health. Okay? And under the presidential form, no, as the Department of Health. Ministry of Health has a minister which is the head, while the department run by group of people or the democratic. Okay? A parliamentary system is a system of democratic governance of a state. Okay, so there is a reorganization of DOH in 1982. Okay, for 1988, no, the generic acts was put into writing, no, under RA 6675, no, ushered the writing of prescriptions using the generic name of the drug. Instead of forcing patients to buy branded medicines, physicians are more encouraged to prescribe generic drugs, no, that can be afforded by the general public. Okay, so remember po that drugs po can be branded or generic po. For example, generic natin is paracetamol, no? Paracetamol is a generic name of your biogesic. Okay, so dito nga part in 1988, no, encourage mga doctor na instead of writing biogesic, they write paracetamol. Mas mura kasi siya, guys. Okay, so let's take a look at the next next year's the 1991. Okay, so in 1991 we have the local government code or the RA 7160. This is where transferred the responsibility of providing health service to the local government units. No, this code establishes the system and defines power of provincial, city, municipal, and barangay governments in the Philippines. It provides for a more responsive local government structure instituted through a system of decentralized whereby local government units are delegated more powers, authority, and responsibilities and resources. Obviously, here po, actually, maganda siya in a sense that instead of waiting for the government, no, let's say for example, ang ating main government man good guys is located in the Malacanang, tama? Because the president's there. But in order for the maging agaran po yung tulong sa atin, no, there should be per per place or per lugar, per region, there should be a kanang direct na to na madtuan, no? That's why meron tayong mga local government units po. Okay, so in Davao City meron tayong local government in Davao City, no? In your barangay meron tayong mga barangay health center na pwede nating mapuntahan. Those are LGUs po. Okay, so mas mabilis tayo matulungan if ganun po yung nangyari. So in 1991 po yan siya nag-start. Okay, so let's take a look in 1995. Ano bang nangyari in 1995? So in 1995 there is the National Health Insurance Act, RA 7875, no, instituted a national health insurance mechanism for financial protection with the priority po, no, given to the poor, no. Ito na yung ginagawa ng PhilHealth. Okay, ito na yung ginagawa ng PhilHealth. So since 1995, no, people working were deducted, no. Actually guys, the PhilHealth share is actually hindi naman siya ganun kalaki dati, no. When I started working, hindi siya ganun kasakit. Pero ngayon na nagtatrabaho na ako in 2024, no, I can tell na medyo, my God, masakit na siya kasi yung kaltas ng PhilHealth is masakit na. So that's why ako, if ever na there are times na need ko talaga ng medical assistant or something, I turn to PhilHealth, no. I use my PhilHealth card, no, PhilHealth ID, yes, ginagamit ko po talaga siya. Okay, basta covered lang. So let's take a look in 1999, no, from 1979 to 1999, medyo madami na yung mga nangyari. So in 1999 there is a health sector reform agenda, no, to which ordered the major organizational restructuring of the DOH to improve the way of healthcare is delivered, regulated, and financed. So here nagkaroon na ng health sector reform. So the DOH was kung kanina na reorganize sila, ngayon naman restructuring na naman. Okay, so let's take a look in 2005. The Formula 1 for Health, no, adopted an operational framework to undertake reforms with speed, precision, and effective coordination, and to improve the Philippine health system. So bakit Formula 1 ang pangalan niya, no, or F1 for Health? Because Formula 1 po is the highest class of single-seater na pang-racing, no, auto racing. No, here it focuses more on the timely delivery of service, no. Mas pinabilis pa. Okay, so 2005 po 'yan. For 2008, there is a Universally Accessible, Cheaper, and Quality Medicines Act, or the RA 9502, to which promoted and ensured access to affordable quality drugs and medicines for actually po lalo na ako, no, in my case po sa father ko, father is diabetic po. Yung gamot na ginatake niya guys, mura lang. Yung kanang pang hypoglycemic na drugs na ginatake niya, mura lang talaga, affordable siya, whereas compared dati, no, mas affordable na talaga ngayon. And this happened noong 2008 because meron ng batas, no, the RA 9502. Okay, and lastly for 2010 we have the program Kalusugang Pangkalahatan, or the Universal Health Care, no. Itong mga nakikita niyo dyan, yung AO, that is administrative order, sabi sabihin si President po ang nag-ano niya, no, Administrative Order 2010-0036. Yan yung kanyang kumbaga kung meron tayong RA, yan yung kanyang title po. Okay, provided universal health coverage and access to the quality healthcare for all Filipinos. So here po, no, ibig sabihin universal health coverage. Actually ngayon pag magkasakit ka, no, if you're Pinoy, if magpunta ka lang talaga sa public hospital, they will cater you naman. Tatanungin ka, ma'am, na kay PhilHealth, tutulungan ka talaga nila. Meron pa tayong ibang mga ganitong bagay such as your lingap, no, na tutulong din. Marami tayong ganito guys, no. So if meron man magkasakit dito, huwag kayong mayang magpagamot, no, magpa-check up sa hospital. Okay, so let's talk about the leadership and governance in the Philippine health system. Okay, so obviously ang pinaka main natin dito is the DOH, no. It is mandated to provide the appropriate direction for the nation's healthcare industry. Okay, so as you all know po, no, that the DOH secretary is naga-change po siya, no. It takes 5 years before it mag-change, 3 years before siya mag-change, no. Naga-change talaga sila. And usually the president is the one who is assigning who will be the next DOH secretary. So for you as a student po of HIS right now, you need to know who is the current DOH secretary. So here po tawag niyan, since they are the leaders, no, and the governance, no, leadership and governance ang ginahandle ng DOH, no, their main goal is to the development of plans, guidelines, and standards for the health sector, technical assistance, capacity building, advisory services for disease prevention. Obviously, if there are merong outbreak, no, usually nag-ano talaga yan sila through media, lalo na ngayon mabilis na masyado magpakalat ng information, no, dapat lang correct information, as well as control of medical supplies and vaccine. So actually guys, no, the DOH has been doing okay nang naman, except lang yung time ni President Pinoy. That is very unfortunate po, no, during the time of Secretary Garin, no, under President Pinoy, that they released the Dengbaksya. Okay, the Dengbaksya was released even though hindi pa ganun ka tested and tested po na effective ba talaga or something. So that's why there are lots of mga nangyari sa Dengbaksya, and yun yung mga mapait na nakaraan na ayaw na nating maalala pero dapat hindi kalimutan. Okay, so remember po here, the LGUs take care of their own health services and are given autonomy under the Local Government Code of 1991, the RA 7160. Okay? So let's talk about more, no, about the leadership and governance of the Philippine healthcare system. Okay, so regional health offices supervise LGU. So kung meron tayong LGU, si regional health ang nag-supervise, no. The duties of this would be develop policies and programs for the health sector, provide technical assistance to its partners, encourage performance of the partners in priority of health programs, no. Remember po, the DOH works hand in hand with local mayors to barangay tanods as their partners in assessing health concerns of the burdens of their local population. They coordinate with each other. So that's why if in your barangay there are problems, for example nagkasakit, merong may mga outbreaks dyan, no, the barangay health center or the barangay po ninyo, no, chairman should be the first one to know kanang unsay nahitabo sa barangay, and then they will escalate it to the higher authority hanggang sa try mo na i-fix there, and then if hindi talaga makaya, that's where na mapunta na siya sa regional health offices. Okay, so let's move on sa tawag yan, sa next natin, no, the schematic or the diagram po. Okay, so number 4 na function pala nito is to develop and enforce policies and standards. Now I forgot, no, we have 6 pala na duties. So we have 1 to 3 yung nabanggit ko kanina, and then we have the 4, 5, 6, develop and enforce policies and standards, design programs for large segments of the population, and provide specialized and tertiary level care. So here po talaga, since the regional offices, actually this is very visible po in terms of kanang actually kung sa barangay ninyo guys, if you really are observant, no, you can see po na merong mga barangay activity sa barangay health centers natin na libre magpa-test for kanang magpag-glucose monitoring, merong mga libreng gamot dyan minsan, and that is part po na ginagawa ng LGU that is being supervised by the regional health offices. Okay, sila po yung nag-ano dyan guys, sila yung sila regional health offices, sila mag-supervise sa LGU para gawin yung mga bagay na yan. Okay, so sa amin sa barangay tawag yung Kabantian, no, kung makapunta kayo, no, merong mga program po doon na kung saan talaga, punta ka lang sa barangay health center, tapos mangayo kag mga tambal sa, let's say, diabetes, bibigyan ka nila metformin doon, yung mga ganun, no, provided that madala mo yung patient. Okay, so they are the ones responsible po dito, no, the regional health office, no, supervise the LGUs. Okay, so let's take a look at the diagram. So ito yung diagram na sinasabi ko guys, no, this is the diagram. Ayan. So makita ninyo, ang pinaka-main is the DOH Regional Office. Ang pinaka-main ng DOH Regional Office would be the kanang sa Malacanang natin, no? But in different region 11 man tayo sa Davao City. Yes, meron tayong DOH Regional Office dito. So meron tayong City Health Offices, Provincial Health Offices, no? Yan, marami sila. So hanggang sa barangay station, sa pinaka-mababa po dito na okay, pinaka-mababa na tawag yan, sector. Okay, so kung titignan ninyo guys, no, medyo because of this, napakaraming natutulungan ng mga tao, no, kay syempre hanggang sa barangay level, good, 'di ba, na-check nila. Okay, so let's move on to the next slide to check for the direction of the Philippine health sector. Ano nga ba yung gustong tinatahak ng Philippine health sector natin? Okay, so we have under this we have different health agendas. Okay, health agenda. So number 1, we have the Philippine Health Agenda of 2016 to 2022, no, to 2022. So when you say tawag yan, direction of the Philippine health sector, it refers to what is the vision for the Philippine health system. Ano ba yung future na naisip natin? Okay? So dito po, the Philippine Health Agenda 2016 to 2022, no, the DH Administrative Order 2016-0038, no, ang title nito is All for Health Towards Health for All, no, as the rallying point for its vision for a healthy Philippines by 2022. Expanded the scope of the universal healthcare directions, particularly through a whole of government approach. Ibig sabihin, ito na yung parang grabe na talagang ano nila na padayon jud ni tabangan nato tanan ingana na mabutang. Okay, so here remember that the health system guarantees population and individual level intervention for all life stages, promote health and wellness, prevent and treat the triple burden of disease, the communicable diseases, malnutrition, and diseases of rapid urbanization, delay complications, rehabilitations, and provide a palliation for both the well and the sick. So remember po, no, since this is covering all life stages, no, whether you're pregnant, newborn, infant, child, adolescent, adults, or elderly, you are covered here po, no. So ang gusto nila, no, is for you to prevent the threat of the triple burden of disease, no. Itong mga triple burden of disease natin, these are the communicable diseases, malnutrition. So as you can see, sa malnutrition pa lang, there are feeding programs, no, being distributed by the government. Okay, yung mga diseases for rapid urbanization, communicable diseases such as your tuberculosis, di ba? So ginagawa niyan talaga ng paraan dyan, no. So it's a kind of care that makes you feel better, no. It makes you feel better po when you say provide palliation po, it means ito siya, hindi ka man ma-cure pero it makes you feel better, no, kanang ma-alleviate yung pain, no. Delay complication, rehabilitation, provide palliation for both well and the sick. Okay, so let's take a look sa another kadugtong nito. Access to health interventions through functional service delivery networks such as your SDNs, no, and financial freedom when accessing this intervention through the universal health insurance. So again, you don't have to worry about paying because you have insurance, covered medical costs. So usually guys, if you have PhilHealth po, na actually every Filipino should have PhilHealth, no. Yung iba kasi talaga na wala, kahit na yung mga minimum wage earners guys, no, nagabayad sila ng PhilHealth. Okay, nagabayad sila ng PhilHealth because when they really need ng kanang assistance, the PhilHealth really can help, no. Kahit yung mga minimum wage earners natin, mga drivers, no, pwede ka man magpaano, kahit na hindi ka employee sa isang kumpanya, pwede ka po mag-avail ng PhilHealth, no. Yung self-employed ang tawag doon, no. Ikaw mismo magbayad, no. Even the students natin, mga interns natin, the interns, before ka maka-internship, you are required to have your PhilHealth po. Although it is the basic, the most basic po ng PhilHealth, but still meron kang PhilHealth, no. Yun yung kinaganda doon, no. Okay, so whenever you need assistance, nakakatulong po ang PhilHealth because remember po, health is wealth. Okay, so this is from the Philippine Health Agenda 2016-2022. So let's take a look at the next direction ng ating Philippine health sector, the Philippine Development Plan of 2017 to 2022. This is the first of the 4 key medium terms plans to translate the vision of a matatag, maginhawa, and panatag na buhay, CHARS, no, for the Filipinos and country. So when you say matatag, it means unbent, unbroken, unshaken. When you say maginhawa, it means comfortable. So when you say panatag na buhay, it means calm, peaceful, and quiet. So yan yung kanilang vision, no? Yan yung kanilang vision na gusto mangyari. Okay? So yan yung gusto nila na mangyari during this time, no, the Philippine developmental plan. So slowly we're getting there, no, we're getting there naman. So ang dito guys, ang next na component natin would be the NEDA, the National Economic Development Authority, no, under ambition natin 2040. Okay, so this plan focuses on the 4 areas, no, building a prosperous, predominantly middle class society where no one is poor, no. Actually mahirap ito, no, mahirap siya na agenda. Okay, where no one is poor. Okay, so 2040. Okay, where no one is poor, promoting a long and healthy life, becoming smarter and more innovative, and building a high trust society. So This is a product of the Philippine Development Plan in 2017 to 2022. Ito siya na ano natin, ang kanyang product is yung NEDA. Ito, okay? These collective long-term plan envisions better life, long-term kasi hanggang 2040 no, better life expectancies for Filipinos and country by formulating policies and implementing programs and projects to attain this ambition, no. You need, here they really want us to have high trust in the government, no. We need to have high trust in the government. Why? Because if you trust the government po, no, actually if the government is good, kung okay lang talaga ang government natin, no, why not? If the government is good, yan, you can trust. Let's say for example sa ibang bansa, all people, like for example in the Australia, no, in Switzerland, they really trust their government, no. So since they trust the government, they really 100% or kanang dili labag sa loob nila magbigay ng whatever income or gross income na ma-achieve nila, because they trust the government, no, na alam nila na dito ito papunta, dito pa ano. But here man good sa atin, since there are lots of things na medyo shaky, maski na ko gani mandabag ang loob ko, kaltasan for PhilHealth, do alam ko naman na okay yung yung gusto ng government, ito yung purpose niya. But with the recent na ilan yung nakuha ni Risa Ontiveros or ilan yung nawala under kay Risa Ontiveros na billion, no, na PhilHealth funds, medyo mag-alanganin ka na magbigay. Okay, but nevertheless, na ito yung aim natin, ito yung goal natin, no, as moving forward, no, is to have a building a high trust society. Okay, for number 4, we have sustainable development goals for 2030. No, this is a compilation of 17 developmental goals that targets to end poverty, no, fight inequality and injustice, and confront issues involving climate change and its effects. So meron tayong global goals natin, guys. Now I'm going to share it to you. These are the global goals natin. Madami ba? Yes, you need to memorize these things, no, because these are the global goals, no. We are aiming for no poverty, zero hunger, good health and well-being, quality education, gender equality, clean water and sanitation, affordable and clean energy, decent work and economic growth, industry, innovation and infrastructure, reduce inequalities, sustainable cities and communities, responsible consumption and production, climate action, life below water, life on land, peace, justice and strong institutions, partnerships for the goals. Okay, so these are the global goals, no, for sustainable development. Okay, so I hope you'd learn something in the health system, no, and at the end of the day, no, you learn that the Philippines is really malayo pa, pero malayo na. Okay, so yun yung ano natin doon, no. We're still moving forward pa naman, no. Wala pa man tayo na stagnant so far, based on what I have experienced, no. And you can ask your parents din talaga sa kanilang opinion what they think about the health system here in the Philippines. Though I think they might give kanang dili nga nakagwapo nga ano, kasi nga if you compare it to other countries, malayo talaga. Okay, but we're still trying po. Okay, we're not here to bash the government, because at the end of the day, the government is there to, nandyan talaga siya, no, to govern the health sector, the Philippine health system natin. Sila man ang steward natin. Okay, so wala tayong ibang magagawa kundi to trust, no. That's why your vote, no, kung magboto man kayo ng presidente, puhon, senators and whatnot, so make sure na you really need to pick the best ones. Okay, kasi nga sila yung magiging steward natin. Okay, so that's it for today. So thank you so much for listening, and I hope you learn a lot. So once again, my name is Sir Neil, and thank you for listening in HIS lecture. God bless everyone. Bye bye.